Very good morning, everybody. Today we will be finishing off with the remaining joints of the lower limb. We have already discussed the two main important joints of the lower limb that come as full question, that is the hip joint and the knee joint. Now, talking about the smaller joints here, we have the tibiofibular joints. These are the joints that are present between the tibia and the fibula. We have three types of joints: a superior tibiofibular joint, middle tibiofibular joint, and inferior tibiofibular joint. जैसे आप लोगों ने अपर लिम्ब में देखा था, रेडियो अल्नर सुपीरियर, मिडिल एंड द इंफीरियर रेडियो अल्नर joint. Talking about the superior tibiofibular joint, it is a plain type of synovial joint. It is a joint that is present between the head of fibula and the lateral condyle of the tibia. So a joint present between the head of the fibula and the lateral condyle of the tibia. The articular surfaces of the proximal tibiofibular joint, obviously they are lined by hyaline cartilage. Whole of the joint will be covered by the joint capsule, and the inner surface of the joint capsule will be lined by synovial membrane. The cavity of the joint sometimes communicates with the knee joint through the popliteal bursa. When we talk about this superior tibiofibular joint, the joint capsule has additional supports which it gets from the interior and the posterior superior tibiofibular ligaments that are present between the head of the fibula and the lateral tibial condyles. Then we have the lateral collateral ligament of the knee joint and biceps femoris muscle. ये laterally help करते हैं joint को stability provide करने के लिए. What is the movement we see on this joint? We have some gliding movements are present in the joint that helps in adjusting the lateral malleolus during movements of the ankle joint. Then we have the middle tibiofibular joint. The middle tibiofibular joint, we know it is this joint. It is a fibrous joint that is formed between by the interosseous membrane that connects the interosseous border of the tibia with the interosseous border of the fibula. When we look at the fibers are directed downwards and laterally. The joint is wider above, whereas it is narrow below, and lower down, it blends with the interosseous ligament of the inferior tibiofibular joint. The interosseous membrane has a small opening in its lower part that gives passage to the perforating branches of the peroneal artery. Now, what are the functions of this interosseous membrane? This is asked in exams. So we know that it provides additional support for attachment of muscles. Additional surface provide करेगा, इसको भी muscles attach हो जाते हैं. It binds the tibia and the fibula together. And it resists the downward movement of fibula by powerful fibular muscles. So this is the functions. These are the different functions of this interosseous membrane. Coming to the inferior tibiofibular joint. Now, this is the inferior tibiofibular joint. It is a syndesmosis variety of joint. It is the strongest of all the three tibiofibular joints, and the strength of this ankle joint, that is an important joint, depends upon the integrity of this inferior tibiofibular joint. Now, what are the articulating surfaces here? The roughened opposed surfaces of the lower end of tibia and the fibula. They are connected to each other by interosseous ligaments. And the main bond between the tibia and the fibula in the lower part that forms this joint is मतलब दो bones हैं आपस में जुड़ी हुई है, मगर जो इनको bind करके रख रहा है वो क्या है? वो interosseous ligament है. That is chief union between these bones. इस interosseous ligament के ऊपर anteriorly and posteriorly we have an important ligament that supports it anteriorly and posteriorly, which is the anterior tibiofibular ligament. And posteriorly, we have this ligament, that is the posterior tibiofibular ligament. The posterior tibiofibular ligament is stronger than the anterior one. When we look at the lower part of this part, the posterior tibiofibular ligament, it forms the inferior transverse tibiofibular ligament here, which passes from the malleolar fossa to the posterior border of the articulating surface of the tibia. The inferior tibiofibular joint permits slight movement to allow the lateral malleolus to rotate laterally during dorsiflexion of the ankle joint. Now, you can remember the difference between these three joints. The superior tibiofibular joint is a plain variety of synovial joint. The middle is a fibrous variety, whereas the inferior one is a syndesmosis variety. Superior में articulating surfaces क्या है? There is an oval facet on the lateral condyle of tibia and the head of fibula. Middle wala is between the interosseous borders and it is via the interosseous membrane. Whereas the inferior one, it is formed by the union of the rough triangular surface of the lower end of tibia and fibula, and they are joined together by an important interosseous ligament and an anterior and a posterior tibiofibular ligaments. Superior में प्लेन वैरायटी है तो ग्लाइडिंग मूवमेंट होगी, मिडिल वाले में क्योंकि इंटरॉशियस मेम्ब्रेन है सो रोटेशन ऑफ फिब्यूला होता है ड्यूरिंग डॉर्सिफ्लेक्शन. इंफीरियर वाले में क्या होता है? इंफीरियर वाला अभी हम आगे एंकल जॉइंट में देखेंगे कि इट एसेंचुएट्स द टिबियोफिब्युलर मोर्टिस, वो क्या होता है वो आगे देखेंगे, एंड अलाउज लेटरल रोटेशन ऑफ द लेटरल मेडियोलस ड्यूरिंग डॉर्सिफ्लेक्शन. Talking about the nerve supply, the superior one is supplied by the popliteal, the nerve to the popliteus and the recurrent genicular nerve. Middle one is via the nerve to the popliteus. ये मैंने आप लोगों को बताया था जब मैंने बताया था कि nerve to popliteus in addition to supplying to popliteus also supplies some of the structures जो पूछे जाते हैं वो यही हैं. Inferior tibiofibular joint is supplied by the deep peroneal, tibial and the saphenous nerve. Coming to the ankle joint, an important joint. Ankle joint is also known as the talocrural joint. It is a synovial variety of joint. It is a uniaxial joint. I suppose you know what a uniaxial joint is. इसमें एक axis पर movement होगी, and it is a modified hinge variety of joint. When we talk about the articulating surfaces, the superior articulating surface or the proximal articulating surface is formed by the lower end of the tibia. Okay. Here you can see this is an inferior view of the proximal articulating surfaces. So we have tibia, the lower end of the tibia, including the medial malleolus. We have the lateral malleolus, and we have an important ligament also that forms this joint. That is the inferior transverse tibiofibular ligament. So here we have this talocrural joint. The superior, the proximal articulating surfaces formed by the lower end of tibia, including the medial malleolus and the lateral malleolus, and posteriorly there is a part of the inferior transverse tibiofibular ligament. These three structures together form what is known as the tibiofibular socket or the tibiofibular mortise. So here, ये structures, in addition to the ligament that is present here, they form a socket जिसमें talus fit हो जाता है और talocrural joint बनता है. जब हम distal articulating surfaces, so this is the talus, this is the calcaneum. Okay. Now talking about the distal articulating surface, the distal articulating surface of the ankle joint is formed by the articulating facets that are present on the upper, the medial, and the lateral surface of the body of talus. The superior surface, we know we have a pulley-shaped articulating surface here, the trochlear surface, the superior trochlear surface. Okay. Then medially we had a comma-shaped facet, and laterally we had a triangular articular facet, which I have discussed in the osteology of talus. Now here, where you can see the articulating surface on the inferior aspect of this tibia will articulate with the trochlear surface. The articulating surface on the lateral aspect of the medial malleolus, this was the medial malleolus, this was the medial surface, this was the lateral surface. On the lateral surface, this part will articulate with the comma-shaped articular facet on the body of the talus, whereas the articulating surface on the medial surface of the lateral malleolus. I hope you understand this. ये medial side है, ये lateral side is obviously ये lateral malleolus का medial surface है और ये medial malleolus की lateral surface है. This portion will articulate with the lateral malleolar surface of the body of talus. So these are the articulating surfaces. So अभी तक हमने बोला ankle joint को हम लोग talocrural joint भी कहते हैं, synovial type of joint है, hinge variety of joint है, uniaxial joint. ठीक, proximal articulating surface कुछ difficult है नहीं, lower surface of tibia, fibula की surface और एक important ligament that is the inferior tibiofibular ligament. तीनों एक साथ मिलके tibiofibular mortis बनाते हैं. Inferior surface जब हम देखते हैं, inferior surface is formed by the articulating surfaces in the body of talus. Superior articulating surface lower end of tibia के साथ करेगी. Medial malleolus की lateral surface पे surface medial malleolar surface comma shaped impression के साथ और lateral वाला lateral के साथ करेगी. ठीक है? Now, talking about the ligaments of this joint, so we have, like any other joint, we have a capsular ligament here, and we have two important ligaments that are the medial and the lateral collateral ligaments. The fibrous capsule completely surrounds the joint. It is attached to the articular margins of the joint all around, with two exceptions. क्या exceptions है? Postero-superiorly, it is attached to the inferior transverse tibiofibular ligament. Okay, so हम लोगों ने जैसे यहाँ देखा था, इस पार्ट में हमने कहा था जो posterior tibiofibular ligament होता है, उसका जो lower part होता है वो thicken हो जाता है, right? वो thicken हो जाता है हमारा, तो वही हमारा ligament बनाता है. तो वहां posteriorly ये इसी ligament पे लगेगा. Inferior transverse tibiofibular ligament पे posteriorly लगेगा. Whereas antero-inferiorly, it is attached to the dorsum of the neck of talus at some distance from the trochlear surface. Trochlear surface यहाँ पे आपका inferiorly लगेगा. The joint capsule is thin in front and behind to allow hinge movement and thick on either sides, where it is supported by the collateral ligaments. We have a synovial membrane that lines the inner surface of the joint, मगर articulating cartilage की present जगह पे attached नहीं होती है. A small synovial process extends upwards into the inferior tibiofibular syndesmosis. Now, coming to the two important ligaments of this joint, we have the medial and the lateral collateral ligaments of the ankle joint. The medial collateral ligament of the ankle joint is also known as the deltoid ligament. It is a very strong triangular ligament that is present on the medial side. It has two parts. We have a superficial part and we have a deeper part. Both parts superiorly, they are attached here, that is at the apex and the medial margin of the medial malleolus. Below, the superficial part and the distal part are and the deeper part are attached at different points. The superficial part is divided into three fibers, which are the anterior fibers. These are the tibio-navicular fibers. Then we have the middle fibers, which are the tibio-calcaneal fibers. This one, and we have the posterior fibers, that are the posterior tibio-talar fibers. So basically, the deltoid ligament is a triangular ligament present on the medial side, also known as the medial ligament, medial collateral ligament of the ankle joint, divided into two parts, superficial part and deeper part. The superficial part and deeper part both superiorly are attached to the margins of the medial malleolus and the apex of the medial malleolus. Inferiorly, the superficial part gets divided into three parts. A part that goes from the tibia to the navicular bone, known as the tibio-navicular part. Then a part that is attached to the sustentaculum tali, that is known as the tibio-calcaneal part, this one. Then a posterior part that goes to the medial tubercle and the adjoining medial surface of the body of talus, of the medial surface of talus. This is known as the posterior tibio-talar part. Then we have a deeper part, that is this. This is the anterior tibio-talar part that is attached to the medial surface of the body of talus. So whole of these ligaments are form the deltoid ligament. These three, tibia से navicular पे, tibia से calcaneum पे, tibia से posteriorly, tibia से talus. ये superficial parts हैं. Anteriorly tibia से talus पे, anterior tibia talar is a deeper part. Okay. Now, this is the lateral view. Laterally, we have important ligament that is known as the lateral ligament of the ankle joint. It has three parts, this, and this. So it has an anterior part. This is known as the anterior talofibular, anterior talus and fibula के बीच में, so talofibular ligament, which is weak, it is flat, and it extends from the lateral malleolus to the neck of talus. Here, this ligament, first we'll talk about this ligament, is the posterior talofibular ligament, which extends backwards and medially from the posterior margin of lateral malleolus. Then we have this part. This is the calcaneofibular ligament. It runs downwards and backwards from the notch on the lower part of this lateral malleolus. Basically, you remember that it goes from the lateral malleolus to the calcaneum. ठीक है? So ये parts हो जाते हैं हमारे lateral collateral ligament के. So here you can see this is a posterior view showing the deltoid ligament. This is the lateral malleolus. This is the posterior talofibular ligament here, the calcaneofibular ligament. Okay, now talking about the relations of the ankle joint. When we look at the relations of the ankle joint, ये relations anterior और posterior है. Anteriorly जो relations है हम पढ़ चुके हैं, एक mnemonic हमने पढ़ा था, that was the Himalayas are not dry plateaus. So anteriorly from medial to lateral side, we have the Himalayas are not dry plateaus, that is tibialis anterior. We have the extensor hallucis longus. We have the anterior tibial artery. We have the deep peroneal nerve. We have the extensor digitorum longus, and we have the peroneus tertius. Posteriorly, from medial to lateral side, we have the mnemonic. The doctors are not here. So we have the tibialis posterior, the flexor digitorum longus, the posterior tibial artery, the posterior tibial nerve, and the flexor hallucis longus. You can make this diagram. अगर exam में आता है, this is an easy diagram. Okay. Now talking about the stability of the ankle joint. अगर ankle joint stable है, तो ankle joint stable है क्यों? ठीक है? तो सबसे important चीज यहाँ आप लोग देख सकते हैं. Okay. So this is an anterior view of the ankle joint, and this is a posterior view of the ankle joint. So when we look at this trochlear surface, the trochlear surface on the superior aspect of the body of the talus is wider anteriorly than posteriorly. Right? आगे wider है, पीछे ये narrower. अब जब dorsiflexion होता है, यानी आप ऊपर की तरफ फुट लेके जाते हैं of the ankle joint, तो anterior wider part होता है of the trochlear surface moves posteriorly and it fits properly into this tibiofibular mortise. Hence, the joint is stable in dorsiflexion. Wider part fit हो गया इस cavity में. अब जब plantar flexion हो जाता है, ठीक है? So ये dorsiflexion में ये point इसमें अच्छे से fit हो जाता है. अब जब plantar flexion हो जाता है, so plantar flexion में foot नीचे की तरफ जाएगा, ठीक है? So the narrow posterior part of the trochlear surface does not fit into the tibiofibular mortise, so this ankle joint is unstable during plantar flexion. So the stability is more during dorsiflexion and less during plantar flexion. And what is the reason behind it? Because the superior trochlear surface is wider anteriorly, whereas posteriorly it is narrow. In addition to that, there are some other factors that play an important role in the stability. These are, there is a close interlocking of its articular surfaces. We have medial and lateral collateral ligaments that are strong. There is deepening of this tibiofibular socket posteriorly because we said that there is an inferior transverse tibiofibular ligament posteriorly. Here, this ligament is present. वो इस cavity को deepen करता है. Laterally strong हो जाते हैं because deltoid ligament होता है और lateral ligament होता है. ठीक है? Then we have tendons जो cross करते हैं anteriorly, वो stability provide करते हैं, and we have other ligaments of the joint. The arterial supply of the joint is by the malleolar branches of the anterior tibial, the posterior tibial, and peroneal arteries, whereas the nerve supply is by the deep peroneal and the tibial nerves. What are the movements we see here? We have dorsiflexion and plantar flexion. Now, coming to some of the clinical aspects of this ankle joint, सबसे commonest thing is ankle sprain जो आप normal day-to-day life में देखते हो कि sprain हो गया. So what does ankle sprain mean? The excessive stretching or tearing of ligaments of the ankle joint is known as ankle sprain. किससे होता है? It may be caused by fall from height या twisting of ankle. Now, when the plantar flexed foot is excessively inverted, the anterior and the posterior talofibular and the calcaneofibular ligaments are stretched and they are torn. Anterior talofibular ligament is most commonly torn. Now, when the plantar flexed foot is excessively everted, the deltoid ligament is not torn. Instead, there is an avulsion fracture of the medial malleolus. Then we have dislocation of the joint. The dislocation of the ankle joint is rare because it is a stable joint. We have discussed the factors that play an important role in the stability of the joint. However, if it is dislocated, it is always accompanied by fracture of one of the two malleoli because ligaments laterally stronger. Then we have a condition that is known as Pott's fracture. That is the fracture dislocation of the ankle. It occurs when the foot is caught in rabbit hole and everted forcibly. What happens here? Oblique fracture of the lateral malleolus occurs. Why? Because there is an internal rotation of tibia. The transverse fracture ये आपसे पूछा जाता है Pott's fracture की क्या-क्या different चीजें इसमें होती हैं. So there will be an oblique fracture of the lateral malleolus. There will be a transverse fracture of the medial malleolus. Oblique fracture of the lateral malleolus will be because there is an internal rotation of the tibia. The transverse fracture of the medial malleolus will be because due to strong pull on the deltoid ligament. Then we have fracture of the posterior margin of lower end of tibia. That is sometimes known as the third malleolus. Okay? This occurs because it is carried forward. These stages are also termed as first, second, and third degree Pott's fracture. The third degree Pott's fracture is also known as a trimalleolar fracture. What is the optimal position of the ankle? The optimal position of the ankle is one in which the ankle joint is in slight plantar flexion. The knowledge of the position is essential for applying plastic cast in ankle region. Then one topic that is left is the movements of the ankle joint. I said we have dorsiflexion and we have plantar flexion. What are the principal muscles that cause dorsiflexion? The principal muscle that causes dorsiflexion of the ankle joint is tibialis anterior. Accessory muscles are the extensor digitorum longus, the extensor hallucis longus, and peroneus tertius. So these muscles, all of these muscles that are present anteriorly will cause movement. कौन से movement करेंगे? They will cause dorsiflexion. So we will have the main muscle is the tibialis anterior क्योंकि हम लोगों ने देखा था this was the main dorsiflexion and a strong dorsiflexion. Extensor digitorum longus, extensor hallucis longus, and peroneus tertius. Easy way of remembering it, right? आगे वाले सारे muscles anteriorly जो है ये सारे dorsiflexors. Plantar flexors कौन से होंगे? Plantar flexors में main plantar flexors आपको पता है सबसे important are the gastrocnemius and the soleus muscle. In addition to that, you'll have plantaris, tibialis posterior, flexor hallucis longus, and flexor digitorum longus. These three muscles. But main muscle posteriorly जो diagram में नहीं दिखाया है हम लोगों ने because tendinoachilles यहाँ present है. This is formed by ये दो muscles किससे बनते हैं? ये tendinoachilles बनता है gastrocnemius और soleus से. So main plantar flexor of the ankle joint is gastrocnemius and soleus. So this finishes the joints of the lower limb. Thank you.